Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek De Silva. Nearly 200,000 total hip replacements are performed each year in the U.S. The sheer number of them tells you just how far this surgery has come. But of course, no surgery is routine. The decision to have a hip replacement is an important one that can lead to a much better quality of life. Here to discuss it is the author of the book, 100 Questions and Answers About Hip Replacement. He's also the past president of the New Jersey Orthopedic Society. I'd like to welcome Overlook Hospital orthopedic surgeon, Dr. Stuart Fischer. Welcome to the program, Dr. Fischer.
Thank you.
So, how far has this procedure of hip replacement come in the past decade?
Well, we've come very far, and we've certainly come very far since surgeons first started doing total hip replacement. At first, we had very few sizes and everything had to be cemented in place. Now there's a much greater range of sizes. The components are more durable. That is to say, they last longer, and we have better ways of putting them in patients. So our hips are more modern and they last longer.
What kind of medical issues would predispose one to having a hip replacement?
Well, the most common medical issue is osteoarthritis of the hip. And osteoarthritis is the most common form of arthritis. There are other types, such as rheumatoid arthritis or arthritis after a fracture. But most people who have a total hip replacement have a painful arthritic hip.
Age? What is typically the age that a lot of people have the hip replacements done?
Well, it's hard to establish a typical age because the age is coming down. When we first started doing hip replacements, it was mostly an operation for elderly people. But now more and more people want a better quality of life. So the average age of people having hip replacements is becoming a little bit less. And people are now having these in their 40s, 50s, and 60s.
What about when we talk about hip replacements, you know, the big thing that you mentioned was quality of life. Is it because people are more active today that they really do want to have these procedures, whether it be a hip or a knee or things like that, that they really want to get these things done?
Most certainly. Patients these days don't want to live with the kind of limitations that they might have 20 and 30 years ago. They want to be active and they want to enjoy life.
Is it always a last resort? I mean, is this type of replacement surgery always a last resort type thing?
Well, yes, surgery is always a last resort. I mean, first you can try anti-inflammatory medication, using a cane, exercises, and other forms of treatment. But the bottom line is when the hip becomes too painful, you can't walk down the block or you can't sleep at night, you'll probably be thinking about a hip replacement.
Yeah, that's usually, you know, you can't do regular activity, you can't go for your walk. That's really what people do. Now, tell me a little bit about how this process works. We have some video that we're also going to show about this, so maybe you can just talk with us about that. But can you just describe here what's going on?
Yes, I can. This is the anatomy of a normal hip joint, and you see it's a ball and socket surrounded by ligaments.
Okay, so...
And here you can see that the hip has become arthritic, where the red stars show the joint breaking down, and you can see the surface of the joint or the lining cartilage has become worn down. The bone on bone becomes painful. So to do the surgery, you make an incision either in the front or back of the hip, and that depends on surgeon's choice, and you expose that painful hip joint. The first thing you do is to bring the ball out of the socket and remove the femoral head or the painful ball of the hip.
So you saw that off, you just cut it off? Is that basically what you do?
That's what you do.
Okay.
Then you prepare the socket, and it accepts a socket component, which is a metal shell with a plastic or polyethylene liner. Next, you use a tool to hollow out the femur.
Which is the thigh bone.
Which is the thigh bone, and you insert what we call the femoral component, or the replacement for the femur. On top of that goes a metal ball, and the next thing you do is put the ball and socket together. And you can see from the animation here that the ball and socket move smoothly.
Wow. That is just amazing. We have a real quick, and I want to show this very quickly. We have a picture of this. And, you know, this is something that we have here. Let me get this in the right position. And this is basically what you just showed us, right?
That's right. And you can see that there is a metal long stem femoral component with a ball on top, a plastic or polyethylene liner in a metal shell. So you're holding a ball and socket.
Right. How long does this surgery typically take?
The surgery can take anywhere from an hour to 2, typically.
And what about this thing lasting? Does this last forever, or how long is it typically good for?
Well, some components need revision, but most don't. Most people will enjoy a pain-free lifetime with no problems in their hips.
Super. Super. Well, thank you for joining us today. Thank you for all the great information. Pleasure to have you with us.
Thank you.